be one of the better. So I'm excited to see some faces. I know there's a couple of groups that are at camp right now. So that's kind of exciting. And I'd really love to see a show of hands of who held in-person programming this year. Yeah, or you can do that hand thing on your, what is it called? The reactions. Like you can do a little thumbs up.
I'll give a half thumb because it wasn't camp, but it was an in-person programming.
I'm a half a hand. I'm a half a hand.
Do you guys want to talk about what you did? Because I think we've all gotten creative this year, and it'd be nice to hear what you guys did, and then just to hear what COVID precautions you put in place and what worked and what would you maybe go, oh, I don't know.
For me, it was our adult retreat we did in person. So that took a lot of moving parts out when we didn't have to have camp counselors everywhere, changing groups and going in and out of rooms. So we, it was basic, but it seemed to work. We just did the symptoms checklist and had people wear masks inside, and we were in a bigger room than we needed for the number of people. So that's really.
Did you COVID test before camp? Did you?
No, we just asked for the symptoms sheet and had people wear masks because it was in May at the end. It was the end of April actually, and COVID tests were available, but it wasn't so widely accessible at that point.
Yeah.
And we roomed people separately unless they were already in the same household. So it was, I said, pretty basic, but we did okay, and it was a small group. So
the small groups helped, I think.
How small is your group?
The group was, including all facilitators, I think 18.
How many campers?
This is adults, so I think 15 adults. Yeah.
Do you have kids camp or?
We only did our kids camp online this year. So that was kind of we asked if there was in-person programming. And so I said, yes, I did have in-person programming, but it wasn't my youth programming.
That's why you're half hand. Okay. Yeah, we had in-person camp, 31 kids. We normally have like 60. So with the kids, we just had everybody COVID tested, campers and the kids, campers and counselors. And the counselors, we required everybody to be vaccinated. So it worked out well. We didn't have, with everybody being tested, we didn't have a strict mask policy. So.
Did you have much pushback on the all staff being tested?
Yeah, we lost some staff who weren't able to get vaccinated, especially some of the hemming and hawing and waiting for the last second. Not waiting for the last second, but they would only be able to get the Johnson & Johnson. Then there was bad press about that particular vaccination, so they were out. So it kind of worked out that we weren't short-staffed, but we definitely lost some staff close to the vaccination requirement. But it wasn't detrimental. It kind of worked out because sometimes it's hard to get that right medium of the right amount of staff to the camp. Knock on wood, it worked good, and it's been over a month and nobody's claimed they've been sick. So.
Yeah. Leilani, what about you?
Hi. So we've done several meetups already. We've done a young adult retreat, and we've done an adult retreat. And in fact, I'm doing another adult retreat tomorrow. The adults are in person, and camp we had was what we call as a hybrid. So it was 4 days of online and then 1 day of in person. Now, what made it work for us on the day camps for camp, we had 35 campers and I want to say maybe 20 volunteers, and they were like firefighters and medical staff. So they were all cleared, vaccinated. And then we had them bring their families. So it became like a family camp. So the parents came with their siblings, and they just spent the whole day out there. What made it work for us is we were able to secure, it's a park that is strictly for military personnel, DOD and families. So we rented the spot and no one else was there. So we got the whole park to ourselves. Kids were able to run outside. They had a barbecue area. We were able to make lunch out there. They stayed until 3:30, didn't want to leave, but I think it all worked out for them because it was the first time that all the kids can actually get together in the year and a half that they've been away. And what made it work for us is the parents' participation and their willingness to ensure that their kids, you know, we tested them before they came in. They all had to sign releases with us. The parents wanted to make sure that if their kids were not feeling well, they didn't bring them, which is why we lost a few kids to get there because some of them did come down with symptoms, but they didn't come to camp. But overall, the parents were very much involved in us getting this to make it work, and it worked out. Now with our adult retreats and our young adult retreats, we'd ask that they wear a mask if they haven't been vaccinated. We ask that they get temperature checked with us, and then all of our programs were either indoors with, I think it's 10, no more than 10 people in a ballroom size room, and the doors had to be open and the air conditioner was running. So that was how we were able to do the adult retreats with programming done inside small groups, no more than 20. That's what we've had it. And so it's been working out. No one's come down sick. And we've had a lot of good, positive participation efforts on everyone who are coming. So I'm happy to continue to provide these types of programs for our families as long as they do follow the rules. We haven't had anyone pushing back on it.
It sounds like you and Tom were both able to require vaccination of staff, and that you didn't. I mean, Tom maybe lost a couple of volunteers, but it sounds like you didn't get a lot of really hard pushback.
No, not really. You know, everybody, yeah, we have plenty of staff. And only maybe a dozen or so weren't, you know, didn't come because they didn't get vaccinated. Not even that much. I think like 6. You know, there were a lot that were not able to come anyway because working in the emergency service, they weren't getting time off, so we were going to lose them anyway. But with the reduced amount of campus, it worked out good. You know, it was only one person I asked not to come back because of COVID. And other than that, I've always been kind of lucky that the numbers always meshed and worked out no matter what the situation was.
And if I can say too, as like Tom, those that wanted to come and volunteer with our kids knew what they were required to do. And in San Diego, it's pretty easy to get a COVID vaccine. So it wasn't like that they were unable to get access to it. I don't think I've had anyone who said they didn't want it because it was not that they didn't trust it. That's why a lot of our volunteers have been cleared before they can come in.
They were all required to be vaccinated?
We preferred that they were, yes. And plus the participants who were with us were all either medical personnel or with the fire departments, and they themselves were making sure that their personnel were cleared. So it worked out. Thank goodness.
When you said prefer, but did you make it mandatory?
We didn't make it mandatory. We didn't, but we told them that this is what we would preferred because we're doing it for the children. And I don't think there's anyone, none of my volunteers ever said that, well, I'm not going to do it for the kids. If they, I think that then I would probably nix them immediately if that was the case. If they weren't going to put the children first, I don't think that they would need to be in our program to begin with. But I think that just because they're volunteering with us and they were going to be leading activities with them, they're going to be in the same close proximity of each other. Even though we were outside, we still wanted to make sure that they were safe. And we ensured the families that our volunteers would do that as long as they themselves were understanding
That was the big sell for me, as you said, to be able to tell the families that all the staff are vaccinated. Me personally, it wasn't that important. It was more important to be tested and take safe precautions. The vaccination, since you could still spread it, I wasn't sold on it. But when someone told me, like, we would like to be able to tell the families all our staff is vaccinated, so if that made them feel comfortable, it sold me to require it.
Yes.
Yeah, the University of Utah would not allow me to require vaccination. So our verbiage was strongly preferred. And we had one staff member who was not vaccinated. So that it's a tricky thing. For sure. We did the 2 week prior to camp phone call to all staff and volunteers, and then the daily symptom checks through Camp Doc, and then 24 hours prior we did a phone call to all campers, just checking in. And you know, it's interesting that daily health screen, I think, just got parents thinking about their health. I had one mom email and say, yeah, I'm doing my kid's, health screen and he's fine, but I'm kind of realizing I have these symptoms, and she went and got checked in and she was positive. And then we had, I think a few of us have talked about our communicable disease plan and how a lot of us with Burn Camp have had if somebody gets the camp cred, we push through and we help kids and we, put them in the little camp nurses area and try and keep everybody at camp as much as we can. And, that changed this year for everybody. So, I think in the past, if a parent were sick, the kids still would have been sent to camp. So that conversation about, I don't feel well, and I'm going to go get tested, and turns out I have this very contagious illness, I'm going to keep my child home. I think that kind of layered thinking wouldn't have happened pre-2020. And then we had one little guy that we did the health check, the 24-hour call prior to, and mom was like, at 2 a.m. he woke up with a really high fever, but it's gone now. I think he's fine. I think he was just nervous about camp. And, our camp medical provider said, our communicable disease plan is he can't be at camp until he's 48 hours fever free and with a negative COVID test. And there was not a lot of pushback, but a little pushback of just, he's homeschooled, he's 7, both parents work at home, there's no way he has COVID. But mom wanted him to come to camp, so she got the test and it was positive. So I think that the pre-screening for us was a success. Those are stories of 2 kids that would have come to camp in any other circumstance, and it was kind of a relief to know that the protocols we put in place were working. Did anybody else have some close calls pre-camp?
We didn't have a close call. I think, as I mentioned before, my camp was like uber strict. I'm from California, so my board was super strict. Everyone was very cautious. So there are a lot of guidelines going through, but because we were so strict with everything, and we didn't mandate the vaccine because my camp was one of the first camps in June and it wasn't accessible to everyone. That may change in the future, who knows? But at the time we couldn't do that. But there was one person who tested positive 4 weeks before camp happened. And because we required a PCR test beforehand and a rapid test when they showed up, when they went to go into their PCR test, because COVID stays in your system a good amount of time, even though you're not being able to transmit it, he tested positive. So because that was a positive test, per our guidelines, he was not allowed to come, which was a bummer, because he was pretty safe. And the county health was like, oh, he's completely safe. But per the guidelines that we had written up, the board was a no on him. So that was the only thing that was a little bummer for us in being so strict. I will say we've done a number of programs in person since then. And as Delta variant has come through, we are now reviewing our guidelines a third time to potentially change things as we're going back to, we were pretty loose and now we're going back to a little more conservative about how we're doing programming moving forward.
Yeah. Yeah, we still have our young adult and adult retreats coming up. And yeah, I think the Delta variant is informing. Like the CDC is still not recommending testing vaccinated people, but we will be testing vaccinated and unvaccinated people for the young adult and the adult retreat. Yeah, it's tricky.
So we did our Camp Courage virtually this year in June, but we are looking to host like a mini weekend camp in October to kind of stopgap between, so that we're not going 2 years without in-person camp. But one of the things that we're running into is kind of, you guys both hit on that, is that Delta variant, and numbers in Arizona are extremely high and our school system isn't handling it super great. And so we're kind of in this limbo of, is it safe to do this? Is it smart? And so it's kind of that weird limbo of, we don't know what to do and when to make the call. So it's kind of reassuring to hear that you guys had measurements in place and they were successful. So it's something that we can implement and try to make it happen, but it's definitely throwing a wrench into our plans, at least here in Arizona.
Yeah, and we had, the phone call 2 weeks in advance, the daily health screen on our Camp Doc application form, and then the phone call 24 hours in advance. And I think that those things, especially the phone calls, really were important. They were important touch points. And then we tested kids, like we asked just one parent, bring kids to the drop off. And for the most part, they respected that. There's a couple of families that didn't. But we asked everybody to stay in the car. And then even when we COVID tested all the kids before they could get out of the car. And then we asked parents to still stay in the car. And, a little bit parents jumped out to hug their kids, but it was pretty, for the most part, people really respected that. I think each session we had one parent that kind of struggled with that guideline, or one car full. So some of those things really did help. And it was nice to know that the kids had all tested negative at the beginning of camp. We still masked indoors. We did a lot of just sticking with cabin pods, cabin groups. There were some pros and cons to that. Things that normally we would have had more free form at camp. We had more kind of scheduled, each group was scheduled for different activities at different times instead of go to the activity with your little group that you want. Just and that I think ended up being one of the things that we might keep. The younger kids in particular talked about how when there wasn't a line at the climbing wall, they felt like they could take their time and work through things that were scary to them versus feeling like, oh, there's kids in line behind me, I better just hurry and give up. So that was actually really interesting feedback from 7-year-olds. I like how they have that insight. And I'll say, I think that maybe today my sphincter muscles have finally relaxed now that we're, a little more than a week post camp, but I was pretty stressed. We did have one volunteer who was vaccinated come down with COVID 3 days after camp. He was only outside with campers and was the horse volunteer, and so was leading kids on top of horses. So in the scheme of things, low risk, but still I had to notify everybody at camp that there was a potential exposure, and we had to, that was definitely, it made for an anxious, I found out on Thursday and camp ended Tuesday. And so it made for a very anxious week.
Kristen, did you ask, do you guys, as a part of your plan that you asked, reporting after camp X number of days? Is that part of your protocol?
You know what? Interestingly, as we reviewed our COVID protocol, our CDP at the end of camp, we realized, I was talking to our camp medical provider about this, and we realized that wasn't in our CDP, but we made the decision that I would just send everybody an email, and she drafted it for me, which was nice. just saying, hey, camp was great. We thus far have finished camp with no COVID cases, but if you're experiencing these symptoms, please reach out and let us know and get tested at your nearest, testing place. But, we just kind of worded it like that. But interestingly, this volunteer is not who reached out to me. It was somebody else in the camp community who he had told, oh, I tested positive. And she said, did you tell Kristen? And he's like, oh no, camp's over. I don't need to let her know. And she was like, oh, I'm going to be calling Kristen. And then I called him and kind of did that contact tracing, but that meant letting risk management know and the head of infectious disease and like all the layers at the university and sending or getting communication with all of our participants and staff. And so, yeah, it was definitely, and he thought, well, I got symptoms on Wednesday and I got tested on Wednesday and I was positive. I hadn't been at camp since Monday, so it should be fine. And it's just interesting what people know too, right? So he didn't, he hadn't thought, oh gosh, well, if I got symptoms on Wednesday, that means I was exposed days before. That was, and I think luckily since he was vaccinated, he didn't get very sick, but I've now heard his wife has it and they have 3 littles at home. So hopefully they're doing okay, but it's interesting times for sure. So yeah, the after camp action will definitely be in our communicable disease plan moving forward, probably with a template of the email that we'll send out. And that will definitely be something that we're adding.
Kristen, would you be willing to share that email? Because I also realized in reviewing our communicable disease plan, like that's not something that I think internally we waited and we went 14 days, not even 10 days, 14 days. If we haven't heard anything from a family, we're in the clear. But I love that additional proactive of like, have you gotten sick? Has anyone gotten sick? And to see like, especially since you have a legal portion or other people who are more than just camp people who worked on that for you, I would love to see what they wrote in that languaging.
Yeah, our nurse practitioner at camp wrote it. So yeah, I will. Let me see if I can share it while we're on.
That's a good point. That was something, yeah, we didn't make the call either, but I think that's truly a good way to stay connected with the families and also just ensure that they nothing was amiss. That's true.
Yeah, because I think that people really aren't, it's not on everybody's minds still, for sure. After, camp's done, okay, moving on. And let me see if I can just.
Yeah, Kristen, it's hard to know what. Hi, I'm Jill. I can't turn my video on, but I work with Kristen on Camp Nanama. But it is interesting the things that we think about afterwards. And we went over our CDP so many times. It was just kind of amazing that we still there's still things that we want to tweak and do differently. And it was just such a learning experience. And it's really good hearing all of you guys and what your experiences were. What I always wonder what the difference is between, is it because we're a state funded entity that we can't mandate vaccines, or is that it? Okay.
That was what Laura Campus Risk told me. And if you notice, the university, it still isn't even mandating vaccines for staff. So it's definitely, I think those state-run institutions are facing something different than private institutions and foundations and colleges. And it's the private colleges that are able to mandate vaccine, and it's definitely an interesting.
Kristen, it's interesting you say that. So we haven't done any in-person programs, but our camp facility requires all of our campers and volunteers to be vaccinated. And the only exception that they allow is a medical exception, because they do serve other kids that are medically fragile, cancer patient, fill in the blank of specialty camps that come to their facility. But they, a couple of years ago, removed a religious exemption. So for them, for our facility. So for some of the stuff that we've asked for parents and volunteers, it's kind of helped because it's been their requirement of us. And so it's not necessarily us, but they leave it up to us as to how we police that. So it's up to us, how do you get the information, how do you verify vaccinations and stuff from both your campers and volunteers. So they haven't made a ruling on that yet for us. They said, it's highly encouraged, highly recommended, but I think Daniel, you talked about this and some other people had as well, because it hasn't received full FDA approval yet.
Right.
That a lot of places are waiting for that as well. So I think once it gets the stamp of FDA approval, then it will be added to the list of things just like the rest. So
Yeah.
I think that's also what a lot of, I know that's what they're waiting for is for that.
Right. And yeah, I agree. It is interesting. Like, I have a friend who runs the amputee camp for the Shriners Hospital here in town. And the Shrine leadership told him he could not run camp unless he required vaccinations of staff and campers. So he had to make sure his campers were of age to be eligible for the vaccine. And he's, he definitely lost some campers whose parents were not excited about that. But he said he also gained some campers that he hadn't had before, whose parents were like, okay, yes, now I feel safe with this. So it is interesting how different, based on what kind of entity you are, what you're able to do.
And Kristen mentioned it, but we did have a discussion group, one of these Friday meetings where we talked about communicable disease plans. So if anyone's interested in reviewing that webinar, if you missed it, all of our past discussion groups are recorded as well as this one, and it is uploaded onto our website. So if you are still working on your communicable disease plan or you like to review other people's, I'm happy to share. I know other camps have offered to share what they're working on. But I think it's just great for us to all have a starting point. And even outside of COVID, I will now use my communicable disease plan for anything related going forth with any program that we do. I did have to realize, because I do multiple programs, is that I will have to tailor our communicable disease plan for every program that I do, not our kids camp, because they do not transfer over. Our family camp is going to be very different. And that's the one I've working on, as we have a family camp in 3 weeks. So there's a lot of different things that we to consider within these.
Yeah, I think that's a great point about how the communicable disease plan, and the one that I wrote for this year with the huge input from one of our PAs, was really trying to kind of cover all the bases of all of our different programs. So it had different sections for each program. But like our adolescent program and our adult program has some busing, like we have to bus everybody to the river put in. And so the requirement will meet federal guidelines asking on public transportation. And so everybody had to wear their mask, the 4 to 5 hours on the bus, both ways. Even after being together for a week, I still made everybody mask at the end of the adolescent trip. Did anybody make any changes to their camp programming that they think they'll keep?
One that worked out really well for us for a family camp was the alternative to being in an inside dining hall. We rented a whole bunch of tables to put under an outside covered gym, and that just really seemed to work out well. So that was one that we're definitely kind of considering for other events. It was just nice to still be outside in the air, and it just kind of had a nice feel for it, and it kind of took down some of the noise level a little bit, and it just kind of worked for us. We enjoyed that. So that's one unexpected thing we didn't anticipate that we might take a look at for future events.
Thanks, Michelle. That's a great. I did kind of like how it made us think outside the box a little bit.
One like really small thing that we did was had a lot more music in our intros and outros for our Zoom meetings. And I think that helped a lot. And then there was opportunities for campers to request songs and things outside of what we would normally have them be able to do at the big dance. And they really loved it when we played their song. And it was just, a Tuesday, and it was fun.
Oh, that's cute.
I mean, as much as I think all of us are exhausted from being on Zoom, one thing that we've utilized and have kept doing is virtual music and art therapy. That's something that we implemented in our camp programming. We've just continued it monthly from there, because we service such a large state and we have campers and participants from all over. It's just something that is easy and accessible for everybody. So we're trying to incorporate more virtual programming into what we already do for those that are on, you know, maybe the reservation land or outlying areas that can't get to where we're based. So it's been something that we were like, oh, we should have been doing this the whole time, but we didn't think about it until we had to do it. So.
Yeah.
Well,
Same.
and you know, COVID really sort of ramped up all that technology too. Like Marissa, that a lot of that wasn't available pre-COVID, or it wasn't as user-friendly for sure.
I was just gonna say, like, I think there's a lot of similarities between Arizona. I would like my sister organization, Arizona, because we also do an expressive arts, expressive music, and expressive writing series now online, and that will continue just a part of our online programming once a month, as well as virtual yoga, which is done collectively as a group, and we have yoga instructors jump online. So those have been really well attended and well received. And then one of the things we did for camp that we'll continue to do is our camp in the box. So we were a little ambitious this year and ran virtual camp and a virtual camp at the same time. So I had about 25 kids who were virtual, and then I had about 94 kids that were in person. And we wanted to let them be a part of it. It was a little too much. I'll never do it at the same time, but we'll definitely be doing a portion of that where we'll be including those who can't come to camp. And I think kids get so frustrated or upset at their parents, or life happens where they can't come. But I think having that virtual component, or even just sending them a box saying that we think of them, I think at least has a touch point. So then we don't lose them the following year. Because I think once you miss one camp, it's easier to miss more camps going forward. So I think that was a nice thing. And then the other thing we did was, since we're making boxes for a virtual camp campers, we decided to make a bunch of boxes for all the burn units that we work with, and then ship them out to the burn units and say, we're celebrating our camp month. We are so bummed that you have kids in the burn unit right now, but we want to give them a little taste of what camp it will be like when they get out, which was a nice little touch where we worked with people, child life specialists, and other people to create boxes that were geared towards things they can do in the hospital, and activities that also represent what we do at camp.
I think we built on that camp in the box idea too, and all the campers that kind of last minute or even kind of weeks in advance let us know they couldn't make it to camp. We sent the backpack with all the camp swag and everything in it. Jill's been boxing stuff up for us. And then we had, that we knew of at the time, one kind of camp age kiddo in the hospital. And so we sent with our child life specialist the backpack and all the things for him. And then she filmed pieces of camp, like the magic show and some other things like that, and showed it to him in the hospital. And so I think that was a nice touch point that we hadn't really thought of doing before for whatever reason.
You know, we use the, not for campers, but we had an adult retreat that is always really well attended. And of course, we had to cancel it for the second year in a row, but we did have it virtually. And so we did the camp in a box for the retreat. So it was retreat in a box, that kind of thing. And so everybody got to open their box and pull out their things at the same time. And I think it really went really well. And it is something I would consider doing again. The other thing we added to that is back a couple of months ago, to kind of carry over that, we sent another gift to those attendees, and with some activities and some suggestions on how you continue kind of the theme of what we were talking about. Our theme was resilience. And so we sent some information on practicing gratitude and we have these little ceramic hearts that they're all very different, but you can use them for mindfulness activities and things like that. And we additionally started a virtual support group that we call the Virtual Gathering, and it has continued and we'll continue that beyond because it's just been a great way. We've probably had the greatest success with that than we have with any support group we've ever done. And so we have actually kind of connected the theme of the retreat with the virtual gathering and use different topics. Sometimes we'll just have a free day. Sometimes we'll invite a guest to come and share their story or something like that. So those things have been successful, but probably would not have been initiated as well as it had not been our need for having to do more things electronically.
I participated in Anita's programs this year. My husband and I participated in her, even though he was at work, some of it, but in the adult retreat, and it was really meaningful to do that. And they also they're so generous to send me that gift. And I emailed Anita when I got it, because it was such, I was like, okay, I need to do this, because it was just cool little ceramic heart, and it just came with such a heartfelt note and some tips and things, and it was just out of the blue. It was unexpected, and I loved that. It was just so nice to get that little package in the mail. And I think one of the things that really stuck with me from their adult retreat was that there was a patient in the hospital who had joined. And there was also someone with very similar experience who was probably, I don't know, maybe 10 years post-injury. And so they had this discussion that was so powerful. And I just thought, man, how great was it for that person in the hospital to get such a jump start on some of that stuff, and to not have to hurt in the way that people who aren't able to see somebody ahead of them, I think that's what we all are hoping to provide. But it was just, I think it was, for me, it opened up this whole idea of the importance of really trying to start really early in the hospitals, and what Anita and Michelle and their team are doing in North Carolina. They're doing that exactly. And I commend you for that work. And I've enjoyed so much getting to join in your programs, because you guys have just such a strong community there. And so it was really, it was really meaningful. But seeing that happen real time, like somebody in garments in a hospital, it just really changed for me that perspective, because we don't go a lot. We're not hospital based, so we don't go in the hospital a lot, but it really has encouraged me to really think through different ways. And one of the things, kind of building on what Daniel was saying, we've been doing a lot of mailings. And so one of the things that I did was send that survey to the hospitals and ask them, to share it with families. And it's a really short survey, just very, basic information. And we're not going to, we say we're not going to spam. We just want to send you a gift. And one of the hospital staffs in it, we got 10 new families in one day. And so I think for me, it just showed like how, we're going to continue to do that and like introduce ourselves in a way. And I think it's a good touch point. And, we got some sponsorship for those. So it wasn't a lot of money, but regardless, it's something we're going to continue to do moving forward, because I hope that, we can get those families involved in our programs. But it was 10 families that have never been involved with what we're doing. And so, there are things like that I'm really grateful for, because it really has forced us to think of new ways to connect with people that, like you said, we just wouldn't have done in the past.
Thank you for those nice words, Mackenzie.
You're welcome.
I want to know why I wasn't invited, Anita.
You're always invited. Do you want to be added to the list?
Yes.
Okay.
Dennis roped me in because he was helping facilitate it. So that's how I kind of always get involved in stuff is through him. But then I was just I just really was so touched by it. And it was funny because my husband was at work and he came home and he really, I'm just going to stay over here. And then he's like over my shoulder looking at what we're doing. Wait a minute, you didn't want to be a part of this.
I will have to say the other added piece to that has been, we've had a number of people who are not our own survivors who have found out about it. I mean, we've, Dennis connected with a couple of people that he knew that he thought it would be really helpful. I mean, he and I have talked about our organizations partnering for years. And, you know, for different reasons, it just never happened. But this has been what I consider a partnership. He's been a really helpful part of that. He's not there, you know, every week or whatever, but, you know, as we all know, Dennis has a very unique way of addressing things. And while we all might not address things that way, because he is Dennis and he is a survivor, people perceive it very differently coming from him than if I had said the same thing. So I do think having that partnership has been very helpful, and we've made some really nice connections with people who are not from our North Carolina survivor family. And I really hope that expands. So it really, and it also enables, you know, we have a second burn center in North Carolina. So we've even had the psychologist from Baptist Burn Center and, you know, other survivors from the other burn center. So it's not just our burn center. So that's been a real plus as well for us to be able to, you know, partner in that way. And ultimately, we're just providing a place for people to gather to get support from one another. So we've been really excited about it. And, you know, we continue to come up with different ideas and themes and, you know, that kind of thing. So it's an evolving project, but one that I'm really excited to say has been very meaningful to people.
That's really sweet. You know, that I apologize if I'm talking too much, but you guys talking about the notes reminded me of a really impactful kind of scenario we had at camp this year that relates back to when we were all virtual last year. Last year, when we were doing our camp in the boxes and setting them up, Jill and I just put handwritten notes in each box, like specific to each camper. And I think a lot of people did that. And it took a lot of time to write handwritten notes that were unique to each person. And, you know, but it was something that we just felt like was important. One of our campers this year showed up at camp with his note. And he said that he keeps that note in his coping box. And it's what he pulls out when he's feeling lonely. So I think those touch points that we make can really last, like, and we can't always anticipate how people will utilize them. And I had no, you know, kind of thought that a kiddo would use it that way, but it turned out to be something really more meaningful than the t-shirt or the whatever that we mailed. It was the handwritten note that was so important to him. So like, I think, Anita, what you did with sending notes to people, there's a chance that even if it's one person, that note is going to really kind of carry them through in a unique way.
Well, you know, when I get those kinds of things from people, and I have to admit, doing these things and having that kind of response from our survivor has been as meaningful and helpful to me during this time. I mean, I remember last year when we did day camp in September, and I said this in our wrap up. I said, I think I needed to do that and to be there with those kids and our, you know, the few volunteers that we utilized as much as those kids did. So it really has been helpful for me in this time of chaos. To providing that to other people has really given me something too. So.
We started to do birthday cards for all of our campers. And what we do is we purchase the birthday cards ahead of time. We then have all the counselors, part of their evaluation packet is like 4 or 5 evaluations and the birthday card. And at the end of the week, they turn the birthday card back into us, and all the counselors write a message to their camper that they had for that year. And then we just have a Rolodex, and of like March, beginning of March, we send all the March birthday cards out. And the kids love it. Like they love getting those, and the counselors have actually been really good at it, of like including like stickers, or they'll take photos that they had at camp, and we have a lot of photo printers, so they just get a bunch of photos and put them in there of their experience. So it's just another continuation and a touch point that like costs us very little money, and then it's done by all of the volunteers, so I don't have to worry about writing all these these birthday cards out to them. And then everyone loves getting mail, especially kids.
Thank you, Daniel, for hacking how I've tried to do birthday cards every year and make it like halfway through the year and then they just goes dive. So never thought to make my volunteers do it. So I love that because office. And then I was like, why are we? Then they just, yeah.
Daniel, one struggle that I've had with birthday cards, because we used to do them and we would actually just, like, we made a new one every year that had some kind of silly picture collage from camps. And then we would we had all the burn campers sorted by month, and then we would put a stack of birthday cards out at the nurses station and ask the nurses to sign them. So it was kind of cumbersome getting the nurses to sign the cards. And so I love your idea about putting them, just having the volunteers and the staff from the cabin do them. But our population is kind of transient. And so we were finding we were getting about 50% of them coming back. Do you have any tricks up your sleeve for that? Like, how do you?
Yeah, so I actually feel like the birthday cards have a double effect because of that. Because then if I send them every month and it comes back, allows me to then give those families a call and say, hey, I got a return mail from you. Did your mail or did your address change? Did your phone number, these things change? And I also think it's the same thing of why we do multiple events. One, we want multiple touch points throughout the year. So that's why we do an event almost every month. But it's also, I get to keep track of them sooner of something's changed. So I have no quick solution of like return mail. The other thing that I was looking into recently was just there are databases out there that you can put in people's addresses or phone numbers to make sure they're valid. It's more for phone numbers that I've found because I make a lot of phone calls to a lot of our survivors and I get a lot of disconnected numbers. So sometimes it helps to put them through these systems to then help you. But in terms of the mailing, it's just one of those things that I feel like we just eat the cost of the postage.
Yeah, there is postal software. In fact, the printer that we send our biggest mailing to runs our list through postal software. But we've cleaned up our database enough that it doesn't really, it would not be worth it for us to purchase the software. The other thing just to know about that software is that you have to update. It's kind of like the GPS in your car. You buy a car and it has GPS. If you really want it to be accurate, you have to upgrade that software all the time. So that's been my experience with the postal software. It's we've had somebody do it for us a couple of times, but I can't say that we got that many people out of it to warrant spending money on it. And that's from a list of like 11,000 people.
Wow. One of the things that we do are postcards because they're cheaper. We just send out little reminder cards, send them out saying, hey, we're still here, remember us, kind of thing. But we do send out postcards as a touch point throughout the year. And when it does come back, it'll either have a change of address, or if there isn't a change of address, we do make the call like Daniel and just check up on them. They update our records. One of the things that we do, again, like Daniel, we have events throughout the year, but we don't just do it with campers. We do it with adults. We do it with the little itty bitty babies as well. So we try and do things that also involve the community. Now, San Diego is really quite small compared to some of the statewide activities. So within San Diego County, we're pretty close that we can still get together for certain events. We just had a Padres game event where we had close to, I want to say almost 320 people come out just for this event. We were giving out free tickets. They had to check in with me, so we didn't send the tickets home. They had to check in, do a will call table right outside the Padres Park. And it was a great touch point. It was a great way to involve the whole family and to congratulate the camper who brought their family. So we acknowledge them as the ones that without you, your family wouldn't be coming to watch the Padres play. So it was a good way to, again, goodwill and bring the families together, and they stay updated with us. And we also ask for current information at that time so that we can ensure that they got the tickets. So it was one way to update our databases at the same time.
That's a great idea. We have the adolescents and adults write themselves a postcard at camp, and then we mail that to them in January. You know, a postcard that may be something that you want to keep with you from camp, a reminder of, you know, a memory at camp. And that's been a really nice touch point. We've done that for, I don't know, years, but that's been a really nice touch point. I love these ideas. This is exciting.
I know, I feel like we need to have a brainstorm session with just some of these thoughts. I think that would be good.
That we could have that be a session at the workshop in 2022.
There you go.
Which is a great segue. We've got just like 4 minutes left. And it's a great segue into the fact that on the IABC website, the registration for workshop 2022 is open. And we apologize for the confusion about 2021. A lot of factors, just like 2020, went into, is this really the wisest thing to hold this workshop this year? Just bringing people from all over the country, and our Canadian friends even going to be able to join us. It became clear that we needed to just get back on our regular track and do it in 2022 and kind of remain safe. And there's like a window where you can change things with a conference center, and then you're kind of eating a lot of money that we don't necessarily have. So we made that really hard decision, but I think now with the Delta variant and how it's kind of hitting people in the country in different waves, I think it was a really wise decision, and hopefully by 2022, we've at least, yeah. So registration is open. Mackenzie has added the link. So please start, looking at that and making sure you're telling your friends from other programs that the workshop is on for 2022, and we're working diligently to, really put a great program together. And I'm thinking, Mackenzie, it would be cool to have this as a workshop and really ask people from different programs to bring actual samples of what they've sent to families. Like, I'd love to see Anita's, what Anita put in her mailing and what Leilani did. And like, it would be really nice to actually see those things. Yeah, that might be.
Email me your address and I'll send you one too.
Oh, you will, Anita?
Or anybody. Just email me your address and I'll send it here. I'll put my email in the chat.
Okay.
Great segue. Kristen, you are so flawless in how you do these things. Just additional things. I just want to, I guess it was pointed out to us by our host camp, which is Camp IAM, the Illinois Fire Safety Alliance, that for any of you who are working with a budget, a smart thing you could do is that technically the conference was supposed to happen this year. So you could put it in your budget if you have the funds to purchase your registration now in 2020, and then in January put it in for 2022 and get double the amount of people to go to the conference, because it's in 2 fiscal years, which was mind-blowing to me, something I probably would have never thought of. And that's the reason why we wanted to get this application registration going now. It is $500 to attend this conference, and I'm going to be honest with you, $500 that is going to cover your room, your board, and the conference is a 100% steal. Like steal. You will not find a cheaper conference that you'll go to that is going to be more pertinent. I have attended a lot of conferences with ACA and through other organizations. You will not find something cheaper. You will have to also provide airfare, which is going to be into the Chicago area. We are only flying into O'Hare and not to Midway. But once you get to the airport, we will pick you up and we will take care of you that whole time until we drop you back off of that airport. So please know that this is a great opportunity, not only for you as camp directors and the leadership, but to invite even like a counselor who's up and coming, your medical staff, your medical director, anyone who you think would be pertinent to this, your CIT director, like all these positions, your LIT would be great to have. It is going to be an amazing workshop with a lot of different content that we're already working on. as well as we are working already on our 2022 ABA session. So hopefully you can register for that, as we got confirmation that our speaker will be Dr. Ruth Rimmer, and she'll be talking about research and the power of research in the burn community. I think we mentioned before the Burn Lit review that's now on the ABA website that the ABA reached out to IABC to do. So like there's a lot of cool things happening. So stay involved, as well as come back next month for our next discussion group.
Also, another plug on the workshop. You know how normally we're sleeping in bunk beds and cabins and whatnot. This year it is at a cushy resort. So that was
Well,
thanks
I'll need a cushy resort.
Yeah, Anita, I know. And that was really thanks to Dottie. It was the location of the workshop was Dottie's choice. And we're really trying to honor her by keeping the workshop there. Yeah.
I hear her voice in my head sometimes.
She came up on my social media feed the other day. Like something I had sent her via social media or tagged her in or something came up, and I was like, oh, Dottie.
Well, she was a very loved woman. So we all should be so fortunate to be loved as much as Dottie. So.
Well, I'm like really jazzed about all these ideas that just got tossed around. I think there's some really neat things to think about. I love the energy that everybody brings to this. So we will see you all next month.
I was saying in
Right.
closing, the energy is because we were finally done with camp.
I have
Lots
two
of
more to
energy
go.
afterwards.
I think when those are both done, I might just collapse for a little while. So Daniel, hats off to you for like, I'm gonna add another thing.
We're not done yet. We've got ours coming up in a couple of weeks, so we're not done yet. We'll be breathing easy in another month.
As the Delta variant spikes and we already have more people in our hospital, and so we're biting our fingernails, you know, literally.
Yeah.
So it's very nerve wracking. So anyway, but it'll be fun.
Well, thank you all for calling in. It was so nice to see all your faces.
Thank you.
Oh, good luck, Sheila.
Mhm.
Thank
Yes.
you.
Bye, guys.
Bye, y'all.
Bye.